We're going to scan for Alzheimer's disease. We're looking for beta plaque, beta amyloids. We can also do MS, select cancers, Parkinson's, and other neurodegenerative diseases.
All right, welcome back inside our proactive newsroom. And joining me now is Chris Moreau. He is the CEO of greymettershealth. And Chris, it's great to see you again. How are you?
I'm good, Steve. How are you doing today?
Good, doing well, doing well. A couple of really significant pieces of news to talk about today. But before we do that, let's remind everyone about the company, because what you're doing is very unique and going to be making a big difference in the United States.
Right. We're introducing into the U.S. market a new brain scanner. It's called a PET scanner, positron emission tomography. It's dedicated to just doing scans of the brain. It's 25% less radiation than the typical PET CT scanners in the market. It's a much better patient experience. You're sitting up, the scanner comes to you, so there's less likelihood you're going to get dizzy or be claustrophobic. And we're going to have these centers all over the U.S. So we're going to cut down wait times. Patients can get in for a needed scan. We're going to scan for Alzheimer's disease. We're looking for beta plaque, beta amyloids. We can also do MS, select cancers, Parkinson's, and other neurodegenerative diseases.
Yeah, and that really leads into the two pieces of news that I talked about. First off, an agreement in place now with ProScan Reading Services, because obviously someone has to be there to make sure they have these scans done properly.
Right. Well, so we're going to do the scans, but what happens is that those scans, each scan produces about 1,000 images of the brain. So those go up into our software, and then we send it out to ProScan, our partner. They're a group of radiologists. There's hundreds of them, and they have 500 clients around the world. They have neuro experts that will read our scans and will provide the diagnosis. And then those scan reports come back to us, and then we forward them on to the referring physician, and we post them on the website for our patients. So our model is not to have a radiologist in each of our clinics. That's not cost effective.
Yeah.
So we'll be outsourcing that very important part to experts in neuro imaging reading. So they're reading the scans.
And that's a great point, is the fact that you're partnering with someone who's doing this right now on a large scale basis. So someone that has the knowledge so when you're starting up something new like you are, you want to have that expertise there.
Perfect. That's a great point. And they have experts, because there's a way to read now amyloid. Beta amyloid is a plaque that builds in your brain. So there's something called a centiloid score. And this is a score that deals with the quantum, the amount, the location on a scoring system that is normalized across different modalities. So it's a key feature. We're really glad that we're partnering with them.
Okay. The next piece of news is you were opening your first clinic up in Davie, Florida, and now you've received your radioactive materials license in Florida, a very pivotal step to get things going.
You know, I have a friend in the capital markets business. Whenever we put out a news release, he already calls me and says, I think of the alternative. What if you didn't get the license? So, of course, we got the license. You need that license because we do inject isotopes into patients. It's very safe, but still you have to be licensed to receive these isotopes and then to inject in those isotopes into patients and manage that. So you have to prepare your facility. You have to have all of the requirements met. So it was, we always were confident we would meet the requirements, but when we received the license, of course, we wanted to share it with the market. So nothing really major left. We announced that we would be open on or before September 30th, and that's the goal.
Yeah, it's all on track for sure, Chris. Thanks so much for your time. Really appreciate it. And we look forward to our next conversation. Okay.
Okay, Steve, take care.
You as well. There's Chris Moreau, the CEO of greymettershealth.